We welcome everyone here this morning. Let's take the roll.
Lou?
Here.
Lou here. Runner?
Here.
Runner here. Block? Hancock? Leyva? Mendoza? Monning? Here. Monning here. Pan? Here. Pan here. Vidak? Here. Vidak here.
And I want to take a moment to welcome our new vice chair, Senator Sharon Runner, who is replacing a longtime friend to education, Senator Bob Huff, and Senator Bill Monning, who is also joining us on the committee. So we have a full complement of 9 members. So welcome, everyone. So the first item on the agenda, we have 17 items today. One item is for vote only. We have 5 bills on consent, and the rest are going to be heard in sign-in order. So with consistent, the first order of business is item 1, SB 277 for vote only. And consistent with my announcement during the hearing last week, SB 277 will be vote only. There will be no public testimony. And the authors will present the proposed amendments today. Members have been provided with an RN and a mock-up. Members may pose questions specific to the proposed amendments to the authors. If members have questions that require clarification from anyone other than the authors, members may request through the chair that individuals other than the authors respond to that specific question. And this committee may agree upon the amendments and condition their votes upon the amendments, but due to timing issues, the amendments will be formally adopted in the next committee by the Senate Judiciary Committee. Okay, so there's no adoption today. So we'll just see if there's a consistent vote to get the bill out. So with that, Senator Pan and Senator Allen, SB 277, please.
Well, Madam Chair and Senators, also staff and the members, and let me just first of all thank you so much for all of your work. While the amendments we are presenting are basically one sentence, they are 2 amendments, and they reflect quite a bit of time everyone in this room helped to craft this legislation. Something, all this time and consideration is something that I certainly very much appreciate. Some of you heard yesterday from a mother, Nina, whose son cannot be vaccinated. She's returned to my district, but her story was for her search for a public school with a high immunization rate that her son could attend. Her story is not hers alone, nor are the stories that many of you have told in this room. All these stories and these lives, along with the ones that we don't hear, are the reason why we're all here today. Now, Senator Pan and I present amendments today that we think strikes a balance for allowing folks like Nina to find a school for her son, and for those who firmly do not want to vaccinate their children. While this is a balance with these 2 factions, it's also a balance for the authors who both deeply believe that everyone should vaccinate a child who doesn't have a medical concern because it makes it safer for them, and for all of us. While this bill won't reach everyone, it will increase everyone's safety against vaccine-preventable diseases. So the amendments will clarify homeschoolers will be exempt from SB 277. Specifically, it will clarify that homeschoolers who register as a private school can meet with other homeschoolers. Second, it will state that parents whose children learn at home and are enrolled through a district's independent study program will also be exempt. In other words, the bill's language will now read, quote, "This subdivision does not apply to a pupil in a home-based private school or a pupil who is enrolled in an independent study program pursuant to Article 5.5, commencing with Section 51745 of Chapter 5 of Part 28 of the Education Code." And for those who like, those with a mock-up draft of this amendment, this is on page 4, line 18. For those out there who are reviewing the legislation, this sentence appears at the end of the Health and Safety Code, Section 120335, and will be in print later this week, as mentioned by the chair, as we go, if this goes past committee and we're able to move to the Judiciary Committee. So we think we've struck a fair balance here that provides more options to parents who are concerned about not vaccinating their children. We appreciate all the time and effort that's gone into this, and appreciate the opportunity to take some questions.
Thank you. Are there questions from members? Leyva.
Good morning, Senators. I just want to thank both of you for your work and your help. As I stated last week, I firmly believe in vaccines. My children have been vaccinated when they were young. They are grown now. and I appreciate your work on the independent study and the homeschooling exemption. And I know that you both are very passionate about this issue, and I appreciate that very much. However, I am very passionate about workers and working families, and I just still have a concern that this will not go far enough to help a two-income family who cannot homeschool their child or a single working parent. So I just want to thank you for your help and the fact that you were willing to take amendments, but I will respectfully be voting no.
Senator Monning.
Thank you, Madam Chair. I also just want to thank the authors and the chair and your staff for working to strike a balance. And clearly in our efforts to find balance, there's going to be people who feel it doesn't go far enough one way or the other. I'm one of those who feel strongly that the public health interest of all Californians is our charge. And as I said in an earlier hearing, striking the balance between individual choice about your own child, if that choice can affect the health of somebody else's child, then it goes beyond the purview of personal choice and becomes a personal choice with community consequences. And because of that, I appreciate your work to try to expand options for those who choose not to vaccinate, to pursue the education of their children. And I see that this version that we're looking at also maintains and protects the medical exemption. And we know some families who, through no choice related to vaccines or not, have children with immune-compromised conditions, families dealing with a child struggling with leukemia or other immune-compromising diseases. Part of our responsibility is to make sure there are public schools where their children can attend without the risk of being exposed or infected by diseases for which we do have vaccines that have been proven safe and efficacious. So with the medical exemption preserved for those families and the expansion in these amendments, I just appreciate it. I want to hear the further dialogue, but again, want to thank the chair and your staff for your leadership on this as well. Thank you.
Senator Black.
Thank you, Madam Chair. You know, last week when we heard this bill, I raised two concerns. One, how great is the harm? Because we're doing some pretty draconian things here in terms of cutting options for parents to educate their kids. So I need to be convinced that there is significant harm done if we don't pass this bill. And Dr. Pan during the week presented me with some modeling information. And would you, Dr. Pan, just relate again, what was the organization that conducted the studies, the modeling?
So the modeling was done by a group of researchers at the University of Pittsburgh. It's based on data from they have school public health, and so they do modeling actually on other contagions. So they've created this modeling to look at what would happen if you had low immunization rates for measles. But they're an expert group that does modeling for a variety of different contagions, some not related to vaccination.
And as I recall, the modeling data showed that with this bill, with the increased vaccination rate, for example, one case in San Diego would probably not result in very many more cases, but without this bill, with the trends we're seeing in exemptions, it would result in really an epidemic of measles in San Diego, for example. Is that correct?
If our basically what happens is that if our immunity continues to decline, we will see larger outbreaks, and I think you saw that certainly you'd see many more people get not only exposed but infected. And in fact, we saw a taste of that in real life with the outbreak in Disneyland. But the modeling certainly shows if the immunization rate had, for example, fallen to 80% for all children, essentially you could see that just spreads throughout the whole county. It doesn't, that you would not be unable to contain the infection, and that many people would be, I mean, you saw a huge number of people who are exposed.
And again, as I admitted last week, I'm no expert in this, so I'm depending on you, I'm depending on University of Pittsburgh Medical School.
And that's
So-
supported by every mainstream scientific, medical, and public health expert and organization in the country.
So then, if we assume, and I appreciate your following up with me and with my staff on this, if we assume then that there is indeed significant harm that the citizens of California would incur if we don't pass this bill, then the second question I had was, do we have less restrictive options for schooling for parents who choose not to vaccinate? Because that is their right to make that choice, even if I personally might disagree with it. And I appreciate, again, that you authors have expanded school options. I would hope there is even greater expansion, but in recognition that you have expanded pretty significantly the options and that you did answer the questions I asked, and understanding that as this bill moves along, there are probably going to be, during the course of Senate and Assembly, 6 or 7 or 8 more committees you'll be going to with this bill, and there will continue to be modifications, I would anticipate. I'm going to vote to let this bill continue, and hopefully we'll continue to see progress that expands educational opportunities while still containing the dangers. So I appreciate your responsiveness, both of you, in the amendments that you presented today.
And Senator, I think both of us welcome a conversation with you about additional flexibility. We share the same concerns, and I'm an educator myself, and we want to figure out a way to make sure this works for all of our families.
Thank you.
Senator Mendoza.
Thank you, Madam Chair. First of all, I want to commend the authors for working so hard on this piece of legislation. As a former school teacher, we deal with a lot of challenges day in and day out. We're always concerned for the safety of our kids, making sure that all their needs are being met in the classroom, whether it be some kids have special needs, some kids might have vision problem, we have to sit them in the front, we have to make sure we have access to the door in case of an emergency, make sure it's clean, everything. We don't need to be worried about whether there's going to be an outbreak of some sort or that every kid is going to be fully immunized or not. I do think that this measure is very necessary to make our profession just a little bit easier on teachers who go to work day in and day out to do the best for their students. So as a former school teacher, I appreciate what you've done and what you will continue to do. And with that, Madam Chair, I would like to move the bill.
Thank you. The bill has been moved. Senator Runner or Senator Hancock, you have comments or questions?
Actually, I listened to the testimony last week, and so I'm kind of up to date on what's happened. Watching it on the TV is a lot different than being here and seeing all the people that are here. I think with the amendments, it makes it better. I'm not sure it makes it better enough for me to vote on it. So hopefully you'll be able to take it to another committee and they can review it even more in judiciary.
Certainly looking forward to working with you, Senator Runner. Thank you.
Thank you. Not necessary. The bill has been moved. Let me just say I wanted to, I appreciate the work that you have done this last week. I, too, reflect the comments made by Senator Monning and Senator Block. This bill does have a long way to go. And while I'm not completely satisfied with some of the movement, I do appreciate the willingness on your part and the willingness of our colleagues to continue to work on this. I do think in terms of public health, it's necessary, but I am concerned about the rights of our parents. So with that, and with no other comments, I think, correct? Okay, let's call the roll.
Do pass to judiciary. Liu?
Aye.
Liu, aye. Runner?
No.
Runner, no. Block? Block, aye. Hancock?
Aye.
Hancock, aye. Leyva? No. Leyva, no. Mendoza? Aye. Mendoza, aye. Monning?
Aye.
Monning, aye. Pan?
Aye.
Pan, aye. Vidak?
Aye.
Vidak, aye. That's 7-2.
7-2, the bill is out. Thank you.
Thank you so much, Madam
members.
Chair. Thank you.
Okay. So with that, let's go on. Can I have we'll have a pause for a moment so they can clear the room. And then Senator Cannella. While we're waiting, why don't we, do I hear a motion to approve the consent calendar? We have, yes, and so we have 3 items on consent and 2 items as consent as amended. It's SB 123 Lou, consent to health, SB 410 Bell, consent to business and professions and economic development, consent SB 708 Mendoza, just plain consent. Consent as amendment, Galgiani, consent as amended to governance and finance, and SB 725 Hancock, consent as amended. Do I hear a motion to approve the consent? So moved? Okay, thank you. Let's take the roll.
Lou?
Aye.
Lou, aye. Runner?
Aye.
Runner, aye. Block? Aye. Block, aye. Hancock?
Aye.
Hancock, aye. Leyva? Leyva, aye. Mendoza? Mendoza, aye. Monning?
Aye.
Monning, aye. Pan?
Aye.
Pan, aye. Vidak?
Aye.
Vidak, aye. 9-0.
9-0, the bills are out. Okay, so Senator Cannella, welcome to the committee. It's SB 131.
Thank you, Madam Chair, members. SB 131 seeks to address the shortage of physicians in the Central Valley by appropriating $1.8 million for the San Joaquin Valley Prime Program. There are currently 27 students enrolled in the SJV Prime Program. This bill will allow them to enroll up to 48 students. California is facing a shortage in the number of physicians available to serve residents in the San Joaquin Valley and rural areas. And San Joaquin Valley is federally designated as a medically underserved area. Implementation of the Affordable Care Act has provided and will continue to provide millions of Californians with health insurance, but access to coverage does not necessarily translate into care. The San Joaquin Valley is severely impacted with fewer primary care physicians and specialists than are recommended by the nationally recognized benchmarks. UC Prime is an innovative training program focused on meeting the needs of California's underserved populations in both rural communities and urban areas by combining specialized coursework, structured clinical experiences, advanced independent study, and mentoring. The San Joaquin Valley Prime Program is a collaboration between UC Davis School of Medicine, UC Merced, and the UCSF Fresno Medical Education Program. The goal of the San Joaquin Valley Prime Program is to attract medical students with strong ties to the Valley who are interested in returning and practicing in the Central Valley. Despite the enormous benefits, the SJV Prime Program lacks funding to increase enrollment that is needed to meet the region's health needs. This bill would provide the necessary funding to continue this important program. This is a bipartisan effort, and I'd like to thank the co-authors for their support for this cause. Expanding the Prime program will increase the number of students who can be admitted and provide a long-term pipeline of physicians that understand the need for access to quality health care in the Valley. With me today, I have a few of the students in the SJV Prime program here to testify.
Okay, thank you. In support of the program, and briefly, please.
Hello? Hello? Oh, just want to thank you, first of all, for letting us testify and speak about our program. And I want to thank my classmates for being here. We have exams and this Friday and finals, but this is so important for us to be here and advocate. So my name is Angel Mendoza. I'm a first-year medical student in the SJV Prime program. And I'm from Livingston. And I just want to show how proud I am from being from the San Joaquin Valley. You might not know where Livingston is. In fact, when I went to college, a lot of people, when I told them I'm from the Valley, and I went to school in LA, they thought the San Fernando Valley. So it's not many people know about us, and it's a large area, and it's medically underserved. But these people who live here, they're deserving of equity care as much as anybody else. They give so much for our state. Agriculture is the biggest industry, and a lot of them, like my father, work in the fields, picking tomatoes. His bonus was taking a bucket home. After earning 25 cents a bucket, that was his reward, extra reward. So, and his is not a unique story. A lot of us probably share similar backgrounds. And the things that we inherit from our parents is that we developed grit and intelligence. To survive, to overcome where we came from, you have to have that. And we just translate that to our education and to our strive to serve our communities in what it lacks. And it's not in the, I don't think it's a wrong association to think that medically underserved areas that doesn't have doctors is deserving of a medical program to create doctors for the Valley. So this program is a gem. It attracts, I think, the most intelligent people from the state, except prior, we would go all over because there was no program. We would go to the East Coast, all over Southern California, but this program brings us together. And we're already making impacts. This summer, we're going to go to Fresno. We're going to be learning how to care for the community that we plan to serve. And we're going to be working with students. And this program is basically training the sons, daughters, and allies of the San Joaquin Valley to serve the community they plan to stay for the future. And training there will help us become better doctors, and we'll establish our roots there and serve there for the future.
Thank you. Please.
Closer. Hello. So hello, good morning, everyone. My name is Yolanda Tinajero. I am from Corcoran, California, which is part of Kings County. I am also a first-year medical student in the SJV Prime program. So I wanted to just paint a little picture about the San Joaquin Valley for those of you that don't know much about my community. So if you were to drive in the roads of the San Joaquin Valley, you would see the great richness of my community, and you can see what the strength of my community is, which is agriculture. My community prides itself in being the agricultural powerhouse that makes the cotton for your clothes, the milk that you drink in the mornings, and also the fruit that colors the tabletops. So with that, though, as you dive a little bit deeper into the communities, you'll start to see that there's something essential that's missing, and that is the clinics, the physicians, and those specialists that should be there to provide quality health care for all of our community members. And that is exactly the goal of the San Joaquin Valley Prime program. We want to create physicians who are going to come back to these communities that are lacking the doctors that are so desperately needed. One of the strengths that I see from my program is that we are selecting talented individuals. And unfortunately, every year we're seeing that we're letting some of these go, as Angel mentioned, to some of the other schools that these students should be here. So that's one of the things that I think you should keep into consideration. Another thing, though, that is great of our program is that not only are we creating physicians who are going to be providing excellent quality health care, but we're also making leaders. And I think that today you're seeing some of this leadership exemplified in this talk. But also, my former classmates are already graduating. They're getting into competitive residency programs. Others are already doing mentorship in the Valley, just so we can recruit more of our intelligent students to be those physician leaders in the future. And with this, I just want to ask you to please stand and support us. Continue to help us to make our goals possible, and that way we can continue to provide healthcare for our community, and that way they can continue to be prideful of their goal of being that agricultural powerhouse.
Thank you very much. Please, briefly.
Good morning. My name is Arturo Gasga. I'm a first-year medical student as well. I'm from Fresno, California, and I would like to share why I decided to go into medicine. Through multiple experiences, but the main experience that I had was working in an emergency department in Fresno. That emergency department lacks many services that could be provided to the community. multiple times, you see patients come into the emergency department that lack primary care doctors. And for this reason, you don't see them when you can prevent a disease, but you see them when the disease is so worse that there's a lot that you have to do for them. Multiple times I can recall seeing patients being sent from Fresno out to bigger hospitals in Los Angeles, in San Francisco, and that's because we lack the specialists. For example, we lack GI doctors, we lack surgery doctors, and that's a very, very important issue that we need to address. And for this reason, I decided to apply and become part of the San Joaquin Valley Prime, because in this program I get the opportunity to interact with people that are committed to working in this community, that they know what could be done, and that they are able to teach me the skills that I will need in the future to become part of this community, to be a leader in this community, and to be able to address the issues in this community. I'm very happy to be in this program because I get to interact with my classmates and physician leaders that are leaders in the community, that take initiative to develop strategies to slowly get down to the valley. I'm going to give you a few examples. This year, our group decided to develop a new program that we call Reach SJV. And through this program, we would like to work with community organizations so that we can learn more about them, so we can become more educated and know what to do with, and learn more about the needs of each individual community. We're going to be doing some clinical work to enhance our skills, to become better physicians in the future. In addition, we need to do some research to learn more about what needs to be done in our community so that we know how to address it, and we'll be doing that too. And finally, we need to worry about our next generation, and for this reason, we're going to be doing some mentorship and students in Fresno State. So thank you very much for your time, and please help us.
Thank you very much. Please.
So my name is Anthony. I'm from Lancaster, California, and I have ties to Bakersfield, California as a student, as an instructor, as a researcher. And just want to exemplify my colleagues as what I feel is the strength of San Joaquin Valley. You have these people who are dedicated, diverse, and very proud of where they come from. And not only do you have these three of my colleagues up here, you have a whole community of these people. And for a community that provides so much for California and for countless other people in the United States, why is it so difficult for them to be taken care of? As you know, there is a physician shortage. As you know, that there is difficulty in access to healthcare. Not only that, but to quality physicians. Why is that so difficult for a community that provides so much for us? And so I'm a proud member of SJV Prime because this is what I can do. This is what I can do with my time, with my energy, and with my abilities to help people. And I ask the community that what you can do is support our bill so that we can expand the program, so we can retain talent, and so we can nurture future physician leaders that will change the healthcare landscape in the San Joaquin Valley. And I firmly believe that a commitment to this program is a commitment to the people of the SJV and also to a healthier California. So I ask the community to please help us help people. Thank you.
Thank you very much. Others in support of the program? Please come forward, and the students can vacate their chairs to make room for others.
Jody Hicks with the California Academy of Family Physicians, and this is an important program, and we're in strong support.
Thank you.
David Gonzalez on behalf of CAPG. Our providers are responsible for the care of some 20 million patients. We're very happy to support this important investment. Thank you.
Okay.
Carrie Hydash, Family Healthcare Network, a community health center in the Central Valley, in support of the...
Thank you.
Mark Engstrom, Central Valley Health Network, in strong support.
Thank you. Any others in support? Is there any opposition? I don't think the committee received any. Are any questions from members? Senator Hancock.
I would move the bill. I think we all voted for this bill last year. Those of us who were on the committee. It's a good idea, and hope it can survive.
Okay. All right, thank you. And the bill has been moved. Any other questions or comments? All right, let's call the roll.
Do pass as amended to appropriations. Lou?
Aye.
Lou, aye. Runner?
Aye.
Runner, aye. Block? Block, aye. Hancock?
Aye.
Just want to make sure you did.
Hancock, aye. Leyva? Mendoza? Monning? Monning, aye. Pan? Vidak?
Aye.
Vidak, aye.
6 votes, sufficient for passage, but we'll keep the roll open for absent members. I see in the audience, we have Senator De Leon, pro tem, with SB 548, item 13.